Dr. Drew here with Inspire Insights, Inspire Cosmetic Surgery and Med Spa. I'm going to talk a little bit about breast measurements. So when you come into the office and we do breast measurements, what are we looking for and what measurements do we take? Well, one of the measurements we take is the sternal notch to the nipple distance. That on average is about 21 centimeters in an average adult female. And it can range anywhere from 19 to 21 centimeters. And then usually beyond that signifies some level of ptosis often. Ptosis means droopiness, or the glandular tissue is lower than it should be. It is not always 100% these exact same measurements, but it's very close in a normal female. So we measured that distance to kind of get an idea of where the nipple sits on the chest. And it also has a very direct relationship to the inframammary fold, or the fold underneath the breast. The nipple should sit at about the level of that fold, so we're looking for that. The other measurement we take is intermammary distance, so that's the distance between the nipples. And that on average is about 21 centimeters, or should be roughly an equilateral triangle. A lot of people have breast and nipple areolar complexes that sit much more laterally, and some people sit more medially. That's not something we can easily change with breast augmentation or even with a lot of different breast surgery. Sometimes we can reposition that a reasonable amount with a breast lift or a breast reduction. So the other measurements we take are the measurement from the inframammary fold to the nipple distance. It gives us an idea of how much gland is below the nipple. On average, this is about 6 centimeters in a normal female adult, and so we take both of those measurements as well. The next measurement we take are the base height and then the base width. So the base height of the breast is the height of the actual breast gland, and in a normal female this can vary substantially depending on the size of the breast. Maybe we get measurements somewhere in the 10 to 14 or 15 centimeter range on average, but they can span bigger and smaller than that as well. We also get a measurement of the base width. So that's the width of the breast tissue or the gland itself. And typically that ranges, if you go with a series of average implant sizes, typically that's somewhere also between 10, 11 centimeters up to 14 and 15 centimeters. So frequently we put in implants that have a base diameter of around 11, 12, 13 centimeters on average. So those are reasons for these measurements. The other measurements that we take are basically all the way around the body, below the breasts, to get an idea of the chest circumference. We take a measurement under the armpits, around the breasts themselves. That is the bust size. So if somebody wears, for instance, a certain size bra, that bust size would equate to what size cup that patient has. And we take a measurement above the armpits, which tells us the chest size of the bra. So when we measure that circumferentially, that would be something like where we would come up with a 32 or a 34C.